Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geeky. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community. Today I have the pleasure of speaking with Dr. Jan Brierley, pathologist, chief of staff, and the lead of the Civility Matters project here at VGH. Welcome, Dr. Brierley.
Thank you, Sharon. Absolute pleasure.
So, tell me a little bit about the Civility Project.
Right. Well, thanks for asking. So the Civility Project actually started 4 years ago for me, mostly because I actually stepped into the role of department head at the time for lab. And I was getting reports in that role of lab staff on the receiving end of bad behavior and reports that were really disturbing and that didn't sit well with me, me in that leadership role. So I felt like I couldn't sit on my hands. I felt obliged to address it or hear more about it. And when I did so, I did some research and came across a great TED Talk by Chris Turner, Dr. Chris Turner from the NHS. And it's entitled When Civility Turns Deadly, When Rudeness in Teams Turns Deadly. And when I watched it, so much was explained. We all know how rudeness can make us feel, but when you start delving into the actual data behind this stuff, it is so compelling. And this was the aha moment for me, truly. I couldn't look away, and I decided to go to our Joint Occupational Health and Safety Committee and see if this was an issue for other managers in the hospital. And indeed it was. Many heads were nodding. They were like, yes, we hear you. This is what we're experiencing as well. And I thought, okay, I'm onto something. I then met with every manager and decided to, based on that feedback, launch into this. And really just starting from a place of increasing the general awareness for the importance of civility in the workplace. And what am I talking about when I say civility? It's not really a word we often use in our common, day-to-day language. Civilis, the word civilis actually is Latin for citizen, right? And the word civitas is a community of citizens. So I like that in hospital, right? We're a community of co-workers all working together for the common goal of delivering the best patient care. And so civility is really about a new mindset of just thinking a little bit more beyond oneself, being a little bit more intentional in how we show up. And so the working definition for the project has been, respect for the dignity of others with intentional consideration as to how our thoughts, behavior, and choice of words can have on the quality and consequence of our social interactions. This is very much the point, right? Just taking that extra step, a new mindset of how might this land with the other person?
We've looked at how interactions within the hospital, collegial interactions, are being thought about in order to impact the civility in the workplace. What about patients? What happens when you have patients that are frustrated, they're in pain, they're not feeling well? It has the same impact as collegial disrespect.
Yeah, it certainly does. And maybe, if I may, I'll maybe delve into what some of the data that's out there on impact of incivility, and then conversely, the benefits of civility on team performance. But I'll get back to that question because it's very, very germane. So when it comes to civility, as a recipient, here we're talking about mild to moderate forms of rudeness, okay? And that's important to delineate or underline. We're not talking about the screaming and yelling, the overt bad behavior that everybody can see a mile away and go, that's egregious, that has to be dealt with right now. We're talking more about those mild to moderate forms, as I said, of rudeness, stuff that flies under the radar. You sometimes don't even know what's going on. Like, what the heck was that? And it can be very ambiguous in its intent to harm. And it's most often just really embedded or from a place of incomplete information or unconscious bias, right? And unfortunately, depending on who you are in the hospital, this can become a daily event, many times a day. These microaggressions, depending on your level of seniority, hierarchy in the hospital, whether or not you're a member of a visible minority or have a disability, or all of those combinations can really, a real reflection of how many times you might experience incivility in the workplace. When you're exposed to incivility as a recipient, there's a 60% reduction in your cognitive capacity and a 30% reduction in your creativity. So your effectiveness at work is reduced. And just by the incivility, you are made no longer on top of your game, right? You're partially shut down. And I think this is what galls us, because we know we can show up better at work. We know we're more competent than we're showing up in a bad environment. And this can get under our skin, and no wonder people get resentful, right? There's initial shock. What the heck was that? And then as we move through the phases, it inevitably kind of goes to resentment if it's not dealt with, and then a desire to get retribution, to even sabotage the team, right? And so that's where it's extremely alarming, especially in the business of healthcare, where there's a patient at the end of the day. So that's bad. It gets worse. The 80% of people are distracted by the event, right? It's all they can think about now. It's occupying their bandwidth. And you can imagine when they're that distracted, errors can creep in. They just do. We're human, right? You're on that track, and errors that ordinarily would never occur can find their way in, and patient care can suffer just because of that. So that's all on the recipient. It actually gets worse than that, believe it or not. On the witness side, they too are affected, right? So that's 60% reduction in cognitive capacity for the recipient. But then when you have any witness to the event, their cognitive capacity is reduced by 20% just by witnessing it. And then it also makes us 50% less willing to help, right? Those pro-social behaviors of wanting to step up and share information, all that's impacted. We're made less kind because of what we just witnessed, what we just watched. So it has a profound ripple effect. So that's the incivility part.
Right.
So if we turn it around and look at the civility benefits, the literature's pointing to a 50 to 60% increase in team orientation, where there is that sharing and seeking of information so that the very best decision can be made with all of the information at hand. And I think that's what the patients want, frankly, right? Not to have this person shut down, that person not willing to talk, not feeling psychologically safe, but having the team work as optimally as possible for peak performance. And it goes on. 90% of people who work in a more respectful environment report increased job satisfaction. They are happier at work. It shows. There's an increase in discretionary effort that's made. People will want to do the extra. This has a real impact on our ability to retain staff as well as recruit, right? Because there's data to show that over 70% of people seeking jobs are looking for the culture reputation of that institution, be it in industry or hospitals. So this is a main driver for people's decision as to where they land and where they want to work.
And that would seem very important right now, given the acute staffing shortages of all healthcare workers and the long waiting lists and the lack of family doctors and all of those things. Recruitment is incredibly important right now. So what kind of results have you seen with the Civility Matters project?
Our aim statement for the project itself, so this project goes from unit, ward, or department throughout the hospital in areas identified as needing some brushing up or some polish in this regard. So the aim statement was to after a 4-month intervention phase with 10 to 11 facilitated sessions over usually a 3 to 4 month period, to see a 70% approval rating amongst those who participate in the civility course. with a survey before anything gets underway, so you have a baseline data, and then a survey at the end to see how things have changed. So that was our goal. 70% participants, does this make a positive impact? And what was fantastic to learn and see was that 82% of the staff in the ambulatory care environment and 88% of the staff in the perioperative service environment said that this was a good use of their time and that there was, they reported a positive approval rating. So that really was wonderful to see. It made us realize that we're on track, that this is something that people are wanting, and we've had a recent regional civility tour with the same Dr. Chris Turner who came out, and 96% of the people who participated said they want more. They simply want more. So you nailed it on the head there with that comment, the staffing shortages and what that could mean for patient care. If more attention's paid to this seemingly obvious piece to the puzzle, it could have huge ripple effects and major impacts on retaining staff and having staff who stay that much happier. And that is bound to trickle down to the patient, right? Patients know when they're on a good ward. It's infectious. Their smiles, you hear the laughs down the hall. People just heal that much more quickly, and it's less of a hard experience to be in the hospital halls.